огромное количество арники везде. Магическое.
Ничего не видно. Отключим сразу, включить часик еще.
Ну, да, не включу.
Так, на свет чувствую.
Каждый. Вот, от нас.
Пришло время,
А, все, да, я тут.
Угу, готовься.
Я готова.
Тогда сейчас подключайся там, чтобы сейчас не было петли. Сейчас, если что напишешь...
Какой еще петли?
А сейчас включи.
А я не знаю, как его сейчас там включить на иврите.
А что?
А у тебя на иврите сейчас все?
Почти, да. Далее. Раз.
Раз,
Ничего.
раз, раз.
Погнали. Раз.
Раз.
Подожди, почему у нас...
Я должна себя видеть, это я запомнила. Good. Good morning, dear colleagues. Today we're going to start a webinar about Christina clinical new product. It's called ProPeel. As this brand was brand new, like 1 year ago, ты можешь включить презентацию? Yeah. My name is Marina. I'm a dermatologist from Russia, from Moscow, and I have possibility to try this new product on my patients, on myself actually, and today we're going to talk about it very precisely to talk how you can use it in your clinic with your patients. We have many products from home care which can provide very nice regimen for pre-treatment, post-treatment, and also immediately after. We're gonna present this new product also in Monaco, like we were there a year ago. But let's talk about ProPeel. So this is marine-based repair and renew treatment aimed at improving skin quality. It's completely different from chemical peels, so we have to take care about it.
Так красиво.
Response acceleration. Specific marine components induce multiple immune skin cell responses, leading to tissue healing and repair. ProPeel ensures minimal downtime through the combination of professional treatment and a uniquely designed post-peel home care regimen. A new and improved tone and texture of the facial skin is achieved. Fine lines and wrinkles are minimized, pigmentation is decreased. The skin appears smooth and radiant. ProPeel is a singular, proactive correction and regeneration treatment for rejuvenated, healthier-looking skin. Christina, it just works. Christina Clinical. Introducing ProPeel, a unique marine-based repair and renew treatment aimed at improving skin quality. ProPeel integrates natural active ingredients with Christina's know-how for skin correction and protection. The outstanding benefits of the ProPeel are: treats and minimizes discoloration, fine lines, wrinkles, and stretch marks. Rejuvenates aging skin by stimulating elastin and collagen synthesis. Blurs textural skin changes. And diminishes blemishes and post-acne scars. ProPeel enables controlled peeling depth at triggering a chain reaction of cell turnover, while securing maximal anti-inflammatory protection and reduction of post-inflammatory hyperpigmentation. ProPeel synergistically combines 3 mechanisms of action, each fulfilling a specific role. The first mechanism, controlled microlesions. When massaging the ProPeel peel into the skin, marine-based particles penetrate through the epidermis, creating controlled microscopic holes and activating natural restorative responses. The second mechanism, intercellular junctions weakening. Specific enzymatic activity weakens the intercellular connections between corneocytes, causing renewal of cells. The third mechanism, immune response acceleration. Specific marine components induce multiple immune skin cell responses, leading to tissue healing and repair. ProPeel ensures minimal downtime through the combination of professional treatment and a uniquely designed post-peel home care regimen. A new and improved tone and texture of the facial skin is achieved. Fine lines and wrinkles are minimized, pigmentation is decreased. The skin appears smooth and radiant. ProPeel is a singular, proactive correction and regeneration treatment for rejuvenated, healthier-looking skin. Christina, it just works.
So, ProPeel enables controlled peeling depth and directed at triggering a chain reaction of cell turnover while securing maximal anti-inflammatory protection and reduction of post-inflammatory hyperpigmentation. As you saw, ProPeel integrates natural active ingredients, silicates, coral rich in minerals, trace elements and vitamins with know-how for correction and rehabilitation of damaged skin. It activates and accelerates natural restorative responses within the dermis, stimulating collagen production, improving skin architecture, tone and texture. ProPeel in clinic treatment followed by a carefully designed post-peel home care regimen ensures minimal downtime without disrupting the patient's daily routine. Actually, the post-peel kit is very comfortable and promotes really minimal downtime. Let's talk about indications and contraindications, because for a doctor it's very important. So, the most popular indication are fine lines and wrinkles. The second is pigmentation, post-inflammatory one or just a regular one. You have to take in consider that there is no chemical inside, so it's totally natural, and so there is no melanocyte stimulation. The third indication is sagging skin, then enlarged pores, blemishes, post-acne, textural skin changes, and stretch marks. Contraindication are telangiectasis, active infection on the face, rashes, open lesions, sunburns, herpes, recent facelift or eyelid lift, Roacutan medication in the last 6 months. Also, you have to take care about patients which have not Roacutan in peros, but maybe some retinol cream on their faces. So any non-controlled systemic diseases and melasma, you have to be very careful with melasma. Let's talk about three active mechanisms. First, there is controlled micro lesions. During the procedure, while you're massaging the product inside, there is small marine particles, small coral particles, which penetrates into the skin and create microscopical holes. Then it activates natural restorative responses, which promote skin remodeling and stimulate production of the healthier looking skin. Then the second point is intercellular junction weakening, which helps the active ingredients to go deeper, especially anti-inflammatory ones, because while there's peeling, some inflammation will be, it's for sure. So using anti-inflammatory ingredients helps to cure and to have less downtime. And the third, immune response acceleration. It's specific marine components which help skin cells to release the growth factors, and physiological reactions leads to great healing process. So, to talk about in-clinic application protocol. You have to take 2 bottles. First contains peel, it's kind of dust, and then you have activator, it's liquid. So you have to mix them together, 1 part of dust, coral dust, and 2 parts of activator. In ProPeel you have extra from corals, there is arnica, leucorids, Centella asiatica extracts. And before treatment you have to clean face. You can use cleanser from ProCare or natural one. Then in Paris on our booth we like to use ProCare peel to make light exfoliation before the treatment. Then I recommend to mix it in advance, maybe 1 or 2 minutes, because this peel has to absorb some water from activator and it gets ready even better. So you can see it's on the slide. You have to mix 1 teaspoon of ProPeel with 2 teaspoons of ProPeel activator and mix it till it's homogeneous. Then you apply a thin layer. Actually today we will have a live demo, so after theoretical part we're gonna try it on a model. Then you apply an even layer onto the skin, massage it. There is a very important thing that compare this ProPeel with chemical peel. There will be no actual peeling while you just applying a layer of this product. Peel starts only in the moment you start to massage this product onto the skin. Also there is big difference, because you can control the depth of the peeling using your pressure, time while you're massaging, and the amount of a product. As you know, in chemical peels you can control percent, you can control pH, you can control also the time, but there is no possibility to make, maybe on the forehead very light one, very light peel, and on the cheeks very deep. And here you can, because you can massage it lightly on the forehead and more with more pressure on the cheek. After you apply a thin layer on the face and massage, massage for 2 or 3 minutes. From time depends the depth, as I told. Then you apply a cold compress on this product to help reduce inflammation, to reduce negative feeling, and then leave it for 10 minutes. And and after you just rinse it off. Be careful, because while you will be removing the product from the face, your patient also will feel some tickling in the skin, like very small needles. You have to tell your patient that after the procedure he or she will be quite red if you made 2 or 3 minutes massage. Then you can use our ProPeel cover cream to cover this skin after the treatment, not to leave patient, with red, flashy skin. This feeling of tingling can last for 24 hours or more if you make a deeper version of this peeling. And if you rinse your product off the patient's face and you don't see any kind of erythema, then you can repeat the procedure, because when there is no erythema means there was no peeling. It was not enough pressure or not enough time for this type of skin. Your patient have to use cover cream in all downtime period, because there is no SPF or some kind of sunscreen in post-peel treatment, so you have to make sun protection with cover cream. And after procedure, your patient will use ProPeel home treatment kit. It contains three small bottles, very cute one actually. For first day, 1 or 2 days actually. I usually say for first 24 hours. They use ProPeel booster. It's non-occlusive formula. It keeps drying the skin. It prevents post-inflammatory hyperpigmentation. It contains salicylic acid, encapsulated retinol, lycopene, arnica. Actually, it's 3% of arnica inside, so it helps to reduce inflammation and to help skin heal better. You have to apply every 2-3 hours, very small layer. After this, you put thin layer of a cover cream. So it's always cover cream after every layer of the booster. Booster have to be used till the skin starts to exfoliate. So when you see some flake on the face, as I told my patient, you have to stop using booster and you switch to the second step. It's hydrator. It's very light and very nice hydration serum. Contains hyaluronic acid, aquaderm, it contains niacinamide, it contains also arnica, and you apply a few drops all over the face, and then you cover it with cover cream also. You can repeat it 4-6 times per day, so as you feel some kind of dryness or any discomfort. You use it for the second and third day, then you switch to resurfacer. Usually it's 4th day. It contains omega-3, 6 and 9, it contains squalene, it contains vitamin E, it contains actually 4% of arnica, because it's a final step of rehabilitation and it has to be very not inflammatory one. You apply a thin layer 5 or 6 times a day. Then you put it, you can cover it also with cover cream. It's very comfort, because when you see this flake on the face, you actually want to peel it off, but to stop your patient from the peeling, from scratching the skin, resurfacer make these flakes and very nice and smooth, and they don't want to peel them off and don't want to scratch the skin. You have to ask your patient to come to your office after the stop of healing process. Usually it's after a week from the procedure, to check if everything is okay. Few words about cover cream. It's very light. It conceals all imperfections, all redness. It's very nice because there is no water inside. There is zinc oxide, calperion, vitamins A, C, E, bisabolol, shea butter, and you can use it after ProPeel. You can use it after laser procedures, after filler injections. It has great anti-inflammatory properties. So, actually we have our ProPeel. We have our ProPeel in, ProCare cover cream in new package. It's kind of sachet inside. It's 50 sachets for 1 milliliter, and I prefer this package to give with ProPeel kit, the home treatment kit, because sometimes people don't want to buy a big bottle, but for a small sachet they always feel it like very nice and special for them. Let's talk about procedure, because this product, ProPeel and home kit, was presented this year in CAS with very famous doctor, Marina Landau. She made a live demo on me, actually. I would like to, yes, thank you. This is me and Marina Landau before the procedure. I was a model, and I would like to tell you, like, step by step what was going on with my skin. This is before and after. I feel like my skin now is really better. The pores are very small, tone is better. I actually stopped using any cover cream or concealing. Immediately after procedure, as I told you, your patient will feel kind of edema. It's very special feeling. You can't compare it with chemical peeling or with maybe kind of laser procedure, because it burns a bit. There is erythema, and even with cover cream, erythema is even. It tells us that procedure was done very nice and very deeply, actually. But using the booster for the first day, you don't feel any discomfort. You feel a bit of burning sense while applying the booster, but anyway, it calms down in 30 seconds. The next day after procedure, I still was using booster, but you see the skin is not so red. Healing process starts actually, and I put cover cream on top of the booster. The third day, I started using hydrator, and I took this picture without cover cream. As you see, there is small flakes on the jawline, on the cheekbones, and erythema is not so even. So even without cover cream, you can be okay in the society, but still you have to put a layer of cover cream on top. Then I miss one day of photography and we can see the 5th day. Since 5th day I start using resurfacer, and actually the peeling stopped because there is no flakes. I feel myself very nice and skin was almost ready, almost healed. Then 3 days after, in this time I using my regular home care, but still put some drops of cover cream on the top. That was really nice healing process. There was no complications or kind of questions. So you can tell your patient step by step. I actually would advise you to make this peeling on yourself, because then you'll understand very deeply what's going on in the skin. You have to tell your patient then there is some conditions which require medical attention. If they have herpes or wounds that do not heal, or maybe some flakiness that keeps going, changes in the skin tone, they have to call your office and ask for help. And some final recommendations: appointment should be in 1 week. Exposure of the sun have to be avoided. Actually, since your patient starts to care about his or her skin, there's a moment to stop exposure to the sun. Once there are 4 or maybe 5 days post-peel home care completed, they have to use Christina Clinical Pro Bright products because they will help control melanin production and straighten the skin barrier. Actually, it's the next step of their home care because it's really nice and innovative home care. They support medical procedures of skin brightening. It can be lasers, it can be IPL, it can be ProPeel, any kind of peel actually. It brightens, it helps prevent post-inflammatory hyperpigmentation. It rehabilitates the skin barrier very nice. My patients really love it. Nourishment, it has great calming and hydration actions. And also, for sure, really great UVA and UVB protection. I usually recommend to use, I'll show you, Total Brightening Serum, even 1 month in advance or before the treatment, if you're talking about ProPeel, because this serum contains very nice smart delivery system, pure white. It helps to stop melanin production on a multi-layer technique. Also, it helps to melanocytes stop producing not only melanin but also deliver the melanin, ready melanin to the keratinocytes. Presentation. Pure white, I told you about it. Also there is other white. It inhibits the entire metabolic pathway of melanin synthesis. It contains L-betaine, inhibits spontaneous melanin production. And for total care, you may use 4 products. It's day cream, SPF 30, it's night cream. Pay attention that night cream contains encapsulated retinol, so you cannot prescribe this for pregnant women. Serum total hydration and serum total brightening. If your patient have problems with post-inflammatory hyperpigmentation or any kind of discoloration, I prefer to use total brightening serum. And if there was mild problems, then I can prescribe hydration serum for night treatment and brightening serum for day treatment to protect the skin while the daytime. If you have any questions about theoretical part, I would like to answer, or you can ask questions using Facebook or my email, maybe Instagram, what you like or what you prefer. Do we have questions on the chat? No? So today we're gonna show you a live demo. We need a few minutes to prepare for it. Yeah? Okay. Okay, so we have started our demo, and we're sorry you don't have sound. I have cleaned my model's face with ProPeel cleanser. Then we mixed 1 spoon of powder, ProPeel, like this, powder, and 2 parts of activator. Now I'm gonna mix it together with fan brush. Till the mixture is homogeneous. It has very nice and creamy texture, very comfort to use, not leaky, not sticky. As we mentioned in a theoretical part, I'm putting a thin layer on the skin, and now there is no kind of peel or any discomfort my model feels. Just maybe small tickleness, and that's it. When you have a model or patient with sensitive skin, I would recommend to you to make your substance more liquid. Or if you feel that it dries a bit, you can add some drops of activator on your gloves before starting the massage. So that's what I'm going to do in this case. I'll put a few drops on my gloves. And pay attention how you make your massage, because you have to use not your fingertips, but the whole fingers, hold the whole square. Put equal pressure with whole fingers and make gentle round movements. Be very nice and gentle for the first time when you see the patient, and maybe for the next time you can go deeper. Ask your patient how long was the drying process, how many flakes he or she has. I prefer to count while I'm making a massage, like 1, 2, 3, 4, 5 in one side, and 1, 2, 3, 4, 5 in other side. Then I switch to the nose, and in this case you can use your fingertip. Be very gentle on the jawline and cheekbones, because there is bones underneath the surface, so it can be a bit deeper in these places just because you put more pressure. So one more. If you feel that product starts to dry, as you can see on this area, you can add more activator if you want to make massage longer, or if you want to make very light version of this peel, you can stop. So I will repeat. If you want to make deeper peel, you have to massage for 2 or 3 minutes. And when you see that your product starts to dry, add more activator. This will help you to make it more comfortable for the patient. In my case, because I have a very sensitive model with very thin skin, I prefer to stop peel on this stage, because I see kind of erythema on the forehead. I see parts with erythema on the cheeks, and find it enough for the first time. The second session I will provide in 2 weeks, because I made very light version, and if you massage for 2 or 3 minutes, then the next session can be provided in 1 month, or maybe even in 2 months. When you stop your peel, you have to actually, not you can, place a cold compress on the face and leave it for 10 minutes. After you will rinse this off, or if in my case I will rinse it with by myself, because there was light version and there is no there wasn't so hurt, so painful. But when you'll massage for 2 or 3 minutes, even small pressure will be very sensitive for the patient. So you can ask him or her to go to the sink and wash it by himself or herself, because while rinse it is with plenty of water, it less hurts than you will rinse it by yourself with your hands. Then, after you rinse your cold compress, you can put booster from the home care kit, or you can use cover cream. I prefer to put a booster like a first layer. In spite it burns a bit, but just in a moment after the peeling, you can explain to your patient that he or she have to be very precious in their home care, because I think even more than half of the result depends from the home care treatment after the peeling. and very useful. Then Christina creates such a nice home peel treatment, like 3 very small bottles, which helps your patient to be very gentle for his skin, because you know sometimes doctors make peeling and don't care about the home regimen. But I find it for myself that my patients with this small home kit, they like it and they don't feel like very long downtime. We use hot compress to reduce negative or maybe warm feeling, because a bit of warm goes from inside. We created micro lesions, so active ingredients from the activator, from the ProPeel, goes deeper into the skin and helps skin to heal better and faster. So let's pretend that 10 minutes passed and rinse this off to see how we have to cover the procedure. I need boost. It's over there. I will rinse by myself. And you see, in this case, erythema is not so even, but on forehead it is. Be very gentle while rinsing this mixture, because every pressure hurts a bit. Yeah, I think. Yeah. You can see erythema on the central part of the face, on the cheekbones, in the nasolabial folds, and on the forehead, but I don't think you can see forehead, but anyway. On the forehead. Yeah. So. Thank you. As I told you, my model is 40. She has really nice skin for her age. She likes using Christina home care. It's normal then when you rinse all product off, your patient still will feel some tickling in the skin. She will feel this till exfoliation starts, actually, from 10 to 24 hours. I'll check if I rinse everything away. Now it's clean. Actually, on our exhibition on IMCAS, I made such kind of demo procedures for everyone who wanted it, and I make even a bit lighter version of exfoliation. So we put booster, like this. Booster from Home Care kit, few drops face, it can be a bit sensitive, like kind of burning sense, but not for a long time, maybe for 10 or 20 seconds. You wait 30 seconds and then you put cover cream on top. I'll put this from a tube, but you can use small sachet if you want from this box. Remember to shake cover cream well before use. No. Okay. And then spread the cover cream all over the face. It contains anti-inflammatory ingredients, it contains zinc oxide, so it will provide nice and even skin tone even after the peeling. But as I show you on my face, on theoretical part, some kind of erythema can be even after cover cream applying on the face, because the degree of erythema can be very different on different skin tones and skin types. More sensitive skin, the more nice erythema you'll have. But as you can see on this model, she's very pretty actually, like real model, top model. We have very nice and even skin tone even after the treatment, and that's it. We've made a live demo for ProPeel, and we give this post-peel treatment kit for the home care, and I know that she has cover cream in the home care, so this will be the home care for the next 5 days. Thank you. Thank you for your attention. And if you have some questions, I'll be happy to answer you, maybe in Monaco in April, maybe you can send it to my email, Facebook or Instagram. Thank you.